So today we're going to talk about the weird things that Chinese medicine has in its history. Like, these are things that you would not believe. Michael started telling me a little bit of a story about something, and I said, well, hold up, you're going to save that for the podcast. Hey everyone, welcome back to the Chinese Medicine Podcast. I'm here with Michael Brown, a scholar of Chinese medicine and an expert in the history in many ways of Chinese medicine. He has written or been part of editing at least six books. We've got
six officially and 7 unofficially. I helped another one, and I'm helping another friend and unofficially, and we've just finished up another one as well.
Yeah. These are things that you just wouldn't believe even existed or had happened in Chinese medicine. And through Michael's career of investigating classical literature, he can read classical Chinese, is that right? And that's a very hard thing to do. It's a very specific art, and he's come across some interesting things. So he's going to share with us some of these interesting stories, and then we're going to get into understanding some of his text. So if you're a student of Chinese medicine and you're looking at, how can I learn a bit more, we'll talk about that. So welcome, Michael.
Thank you for having me, Marie. It's
Fantastic.
a pleasure to be here. It's been, 5 or 6 years since I was last on?
Actually, yeah.
I think it's been a while.
Yep. You can go back and look at that video. We'll both be younger and
what 5 years of everything that's happened in the last 5 years does to you?
Oh yeah, exactly. Yeah. Let's not talk about that. So what? Let's go with the top story that you think is the weirdest thing, and you've discovered this through your historical.
I'll give you a little. I'll just open up a little bit about where. Talk a little bit about the book that it comes from. Alan decided to do these 2 volumes of the Jingyue Chuanshu, and these were Jingyue's new formula. Okay, and he created a lot of things, but probably if you're studying herbalism, you will know like Yogui 1 and Zhogui 1. Yep. And those are the 2 of like his arguably most famous formulas. And when Alan was translating the text, he thought, I'm not just going to translate this text, I'm going to go through and find later commentaries of these formulas as well. And even in Chinese, you will not find anything like that. So this is even more unique than you will find in Chinese language, what Alan has put together here. And in addition to adding these later commentaries, he also tried to find case studies in his book where Jingyue used these formulas himself. And so there's a few very interesting case studies in there, but this particular one stood out to me because I think I was working on it about the time that my son was quite young as well. And it was a case where this young child, I think maybe 1 or 2, his mother had given him like a nail that was holding a sole of the shoe together or something. So it wasn't very big, and the child ingested it. And so Jingyue tells the story that like his father was shaking the child upside down, trying to get the needle out of the child, and he was like bleeding and things like that. And the mother came in to Jingyue and said, I really, really need your help. And they went to Jingyue and requested his assistance in what to do. And I just thought, this is something that is so out of left field, because people, at least in my clinic, will come through and they'll say, children get Chinese medicine. They almost had this perception that Chinese medicine was, in China, Chinese medicine was just medicine. It's all that you had from when you were born until you died.
Yep.
So Chinese medicine covered everything that you could imagine. And pretty much any disease that would be kind of around today was written about in Chinese medicine, that they just maybe have a slightly different understanding or different names. But everything, from skin conditions to emotional, everything is in Chinese medicine and written about. So anyway, this case, this child is upside down. He's ingested this nail. Jingyue says, no, you can't do that. And he says, well, the nail's been ingested. We can't make him throw it up or make him vomit it up because that will cause too much damage. So, and I just thought this was absolutely ingenious. He came up with this formula, and I might get some of the ingredients wrong, but I'll try to get the understanding of it correct. Is that
it's okay? No one's going to use it at home.
they'll pick up the book and they'll read it. It is like wrong ingredients. This is it. Did he even actually work on this book? I'm not sure. So he came up with this formula, and it was something like using like pig's lard, magnet, some honey, and maybe Meng Shao as well, which is a purgative.
Yep.
And he like put this all together, and anyway, he gave it to the child. The child digested it, and the next day they said that he passed a stool, and the nail was in it.
Wow.
And so he talks about what he did, and he says something like, "Oh, you know, if I didn't use the honey or something like that, the child wouldn't have been able to ingest it. If I didn't use the magnet, which is I think it's like 自视, then the nail would have nothing to bind to."
Yes.
And he used the lard as well, and he said because if I didn't use that, then it would have damaged the intestines coming out, because it almost like came in, like the nail was bound up in the pocket of the lard,
it was
and
like
everything
drawn
together.
towards it in the center and then encompassed in it.
Yeah, and so it protected the intestines on the way out. And I just thought to myself, you know, it was ingenious. I couldn't never imagine, you know, reading a case. To me, it was always like, the cases that I normally read were things like, you know, insomnia and, you know, digestive problems, skins, the kind of things that you would think you would normally see. But this was such a beautiful insight to, like, you know, being a parent myself and thinking about a child in distress and what, you know, the panic that was set in, and then having this physician come in. I couldn't believe it. There's a few other interesting cases in there as well. He talks about these cases of these people feigning illness.
Okay. Like as in pretending
to be sick. And there was an interesting case where I can't remember what happened, but there was a guy and he had either maybe like a concubine or like a mistress, and I can't remember, or he was visiting something like that, one of those kinds of houses, and something had happened to this lady, and she was pretending to be, I think, like comatose or something like that. They maybe call it like jue in Chinese, like a reversal. She wasn't responding. And so,
but she's pretending.
So Jingyue says that he tries to like grab her arm, and she just like snaps it back, and he's thinking, you know, is this person pretending or not? And he goes, okay. And he says something like, I can prepare this one dose of medicine, and if this doesn't work, then I have to do some very extreme moxa or something like this. So he's like, if this one dose of medicine doesn't recover the person, I have to do some like really intense scarring moxa or something like that. So he goes off, he prepares the medicine, and he comes back, gives it, and the person recovers. So he doesn't actually have to do it. Yeah. But it also kind of saves the face of the person as well, because he doesn't call them out for pretending. He sort of gives them this like avenue to recover without having the kind of painful, dangerous treatment as well. And he has like one or two other cases about that. There was another case where they had this fight, and they said, oh, this guy, he coughed up all this blood in a basin, like just all this blood, and he goes, this isn't right. Like he takes the pulse, and the pulse isn't critical, and he does a similar thing to that person as well, because I think he got into a fight, and they said he was like severely damaged and he was coughing up all this blood, but it was actually blood from an animal. So he gives him like another way out. Those are two. Oh,
you mean so he was pretending with blood, but he was drinking blood and then.
No. Well, I think he cut an animal and said like he coughed up all this blood, but because when Jingyue analyzed him, he didn't have these critical blood loss signs in his pulse and things like that. So he goes, you know, I think this guy is playing as well.
And if a patient coughs up blood, they don't bring the blood to prove it to you either.
Well, I think they might have said in the basin. I don't think they dangerously brought it. I think maybe the parents or something like that.
It's kind of interesting that to know that they had that kind of like, what do we call it here? Munchausen syndrome.
Sorry?
Munchausen syndrome.
Oh, is that when you okay.
When you pretend.
I haven't actually heard that term.
Yeah, that's basically pretending to be sick, and it's it's like psychotic disorder, like it's in the DSM-5. Munchausen by proxy is you're getting attention by making someone else sick, right?
That's basically the idea, you know. They're kind of like feigning illness to put someone in a bad spot. Yeah. So
okay, so these are interesting. What else have you got?
Well, Jingyue talks about this case, and this is interesting because Zhang Jingyue often seen as the most famous herbalist of Ming dynasty, which is something like 1300 to 1640 thereabouts, and Jingyue lived 1563 to 1640 himself, so just around the end of the Ming dynasty passed. He wrote two very famous books, one called the Leijing Categorized Classic, and then his Junior Translator, which is where these books are from. And he talks about this case where, I can't remember exactly, but there was this guy, and he always had this kind of really bad, maybe chest pain or abdominal pain. And he'd seen a lot of, I think, other physicians, and Jingyue himself tried to fix him, and just nothing would work. And what really struck out to me in this case was that at some point he just goes, oh, you know, where the pain is exactly on, I think it's, is it Zhang or Zhang liver 14.
Okay.
So what does he do? He moxes it,
Yeah.
and that cures the person.
All right.
And so this is something in history where I think people have perpetuated this idea, is that there is a clear delineation between acupuncturists and herbalists. You hear, like, in the history, you know, the herbalists, they wrote all the books and things like that. But a lot of herbalists and a lot of famous herbalists who wrote literature would write about acupuncture, would write about the channels and things like that. So,
Well, Zhang Jingyue did. Right?
Absolutely.
He was
He's like the OG, right? And he has acupuncture treatments in his book. But so he uses liver 14 moxa to cure that after herbs wouldn't work. And what's also really interesting about Jingyue is that, once again, we look at all these books, but he wrote some stuff on acupuncture, okay? And I remember I would always tell people when they read Manual of Acupuncture that, you know, if you get into clinic and you have a disease, that one of the most important things to do is look at Manual of Acupuncture. You can see the points that treat that disease.
Yep.
You can also see point combinations in it. Most people just read the location and the functions, and that's as far as they get. And Manual of Acupuncture, I think, is actually one of the best books written about acupuncture points in English or Chinese.
Okay.
Even in Chinese, I rarely see a book that has as much content in that. I think that shows partly, you know, how good Mazen Al-Kafaji and Peter Dedman were when they put that text together. It's really, I find it hard to believe that another text will come along to surpass that in English. Yeah. I think the books that I translated on acupuncture points work as a very good companion to them. But
yeah, you're absolutely right, because as a student using that book and as a teacher seeing people use that book, you basically use it as a reference tool to how to find the points. What's the direction of needling? What's the picture where the point is? And yeah, like you just think, oh, I have to go and buy a book that says acupuncture point combinations. Yeah. Well, you can save yourself the money. That's what you're saying.
What I was gonna say is that in that book they list these individual point kind of combinations or parts of songs that has been used for different indications. Jingyue did that 400 years before. In his in his Lei Jing 2E, which is something like the pictured appendices to the categorized classic, he writes a whole big part on acupuncture. And for example, he might put like lung 7 or it's then used in this song, this song, this song. And this is the guy who had like no access to computers to kind of find through information. So he's gone through these texts and he's compiled them in there. And so one of the things that I really, really love to look at when I'm reading books is to see when was this first idea done, like combining or taking out these single indications from songs and odes about acupuncture and putting them under a point as opposed to just listing a song, because then you start to kind of see how information is grouped together as well. That's also one of the things that I find interesting, is that when I open up a book, the books are always arranged a little bit differently, and you can kind of get a little bit of an insight into what the author might be trying to emphasize. Right. What are they trying to emphasize in the way that they've outlined their book? And then when they look at it, when they talk about the disease, how do they write about a disease? Do they initially quote the Neijing? Do they write a little bit of their own information? Do they start off with symptoms? Do they start off with pulse? Do they then talk about their own formulas or things like that?
Is in classical literature or things that are maybe post-classical, like not Han Dynasty classical, but you know, older Chinese texts, did they have a reason, a rule, like the first mention and that kind of, you know how in some kind of hermeneutics they say first mention, most mentions, like they're most important, like you're saying, like what did they write about first? Does that always mean that was the most important thing they wanted to emphasize because they put it first, or?
I'm not sure. I think probably everyone kind of came at it from different styles, I would say. What I tend to see, and it might depend on the text, but they did tend to reference the older texts first. Right. And so, for example, in Jingyue's book, he'll show, like for a disease, maybe like back pain or reflux, he'll list all the Neijing stuff. Yep. Okay, like all the quotes from the Neijing that might be in there. Then he writes a little bit about how he sees the diseases and the patterns. Then after, he has what he will then quote later physicians. So maybe famous people like Lu Wansu, Li Dongyuan, Zhu Danxi, and those are probably kind of like the major famous physicians before his time. There's plenty more after, but those were the major ones. So he would then kind of quote those after, has a little bit of additional information, and then he would put formulas down or treatments as well. So you kind of get, the classical information, Jingyue's understanding, and then any additional information that he thinks is important enough to include as well. So Jingyue was very much a scholar of the classics, and so he put those first, which really kind of shows what emphasis he would place on. Not everyone would do that. Some others would do it differently. It just maybe depends on the type of text that they wanted to write. But generally you see them quote the classics first.
Yeah, it's like honouring the people that came before you. That's a big part of Chinese medicine, right?
Well, one of the things about Chinese medicine that I think differentiates it from a lot of other things is that in terms of what we do, cupping, bleeding, those things existed everywhere out through the world. Egypt, Greece, plenty of other cultures had cupping and things like that, and maybe even and probably bleeding as well, But what defines Chinese medicine is really an adherence to a philosophical idea or doctrine that came from the Neijing as well.
Yep.
So when they would bleed or when they would needle, prescribe herbs, is based on a philosophical idea and doctrine as well that informs what they're doing as well. And that's what really makes Chinese medicine unique. And they kind of have these texts and everything comes back to those texts. And if they disagree with it, they'll and people have disagreed with things throughout the history. And for example, in my book, I think they talk about something like, he talks about all the channels meet at like Bai Hui or Du 14, something like that, like Du 22, 14. And he kind of like says, he analyzes the pathways from Ling Shu chapter 10, which is the chapter on channel vessels where all the pathways come from today. And he sort of says, they don't all link there, but maybe what they meant was that some of these other channels like combine with these channels to meet there. So he says it's kind of wrong, but we're not going to say it's wrong. This is kind of how he worked it out, because you don't want to exactly insult the classics, but you kind of need to clarify and add a little bit of kind of this, this is perhaps what they meant. This isn't exactly right, but let's not say that they're wrong, but we'll try and figure out a way of justifying it.
Yeah. So it must be exciting when you're doing your research, because it's kind of like probably not exciting.
Is a word for it. One word for it.
No, I mean when you come across these crazy stories and you think, what? I've never heard that before. And I'm pretty sure has there ever been? Are these, when you've done these translations, was there stuff that has not been translated before that you've wow, this is so? It is all like that?
Well, coming back to these first two books, if I can pull them out.
Bring this massive stack up.
The explanations of channels and points. I remember the first time, and I remember if I would like. Can I open it?
Hold it up.
I was going to open it because I remember I was reading it in Chinese, and I remember I read Lung 5, and the first thing that struck me out when I read Lung 5 was that in this text, written in around 1680s, that they numbered the points.
Yeah, okay.
So we often think numbering the points was a later addition.
Yeah, we were always told that.
No, this happened in early Qing dynasty. So this is the first book ever to number the points, okay? But then I remember reading it, and he says something like, where he goes, and he says, he goes, when the lung is dry, there will be signs of sorrow and crying. It is appropriate to tonify the water point of the lung in order to moisten dryness.
Right.
I just remember, I read that, and I just thought, I've never read anything like that anywhere in English.
Yep.
This book needs to be translated.
Okay.
And I worked on the long chapter, and I thought to myself, this isn't bad, but I need someone to edit it. And I sent it to Alan, who we'd never met, and we just spoken online. And Alan said, "This is great, but your translation's really bad." so he was.
Oh snap!
Alan, well, he goes. Look, do you want me to, be nice when you're editing, or do you want to, do you want me to go really hard? And I said, well, look, what's important is that we get the best work out there.
Yep.
And my feelings don't matter. What matters is that the work is the best that it can be. And ultimately, this was the first one that we've done, and we've learned a lot since then.
Yep.
So, we would go back and think, oh, well, we need to make changes and improvements. But ultimately, each time you do a work, you learn so much more about just styling, translations, approaches. But that was probably like how kind of I got into it. And
so you learnt translation by translating.
well, I studied
into it.
Yeah. I read and I studied honors at University of Queensland in classical Chinese under a teacher, and there I wrote a thesis on yin and yang in philosophical, two pre-Huangde Neijing philosophical texts.
Right.
So I did a bit of translating with that with help from my teacher, but it was still, it wasn't really at a professional level and quite scrappy. But that's when around 2015 is when I really started kind of reading Chinese medicine in Chinese, and I haven't really looked back since then because, just when I look at how much literature is in Chinese, it really is incredible. And when you think about, you might have this question about something like, oh, in Chinese medicine, why are there two fires? People have asked, people have like had their own opinions of that in Chinese medicine kind of years ago, And I've like those kinds of things I've thought about as well. And then I read it in Chinese, like, okay, yeah, that makes sense. And because the idea is, like we have a heaven fire like the sun, but also fire is something that we can produce on Earth as well. So we have the heat from the sun.
True, yeah,
but
that makes sense.
we can't do that quite like the other elements we can. We can't really create a cold. We can kind of create a wind, but the wind is the same that will create, dryness also. And what's the other one? Yeah, you have heat and fire and dampness as well. Dampness is also kind of like hard to create as well. But you can create a fire on the ground and you can get heat from the sky.
Yep.
So arguably that's why there's two fires.
Okay. Yeah.
That's kind of what I think.
Yeah.
Yeah.
Yeah. Cool. You are a wellspring of knowledge. We could talk about so many. There's lots of things we could talk about. Anything else that is a crazy story? People would love the crazy stories.
I think
Crazy cases. Anything interesting?
I think one of the interesting things, if I could talk about this bottom book, which is something that we've just recently done, which is the systematic differentiation of warm diseases, is that, when working on this one, he talks about his kind of like life, and he has a biography, but the person who wrote the preface for this book would be basically, I think, the Attorney General of Australia or something like that, or what you might say, what if you're in America, like someone who runs the Department of Defense or something like that. Okay. Like that high of a person was who Wu Zhutong, the author, was working with, and I think he like critiqued his work and he added in the punctuation for it as well. So he was really working with some very high level people or friends with high level people, and his story is really interesting because we often hear this idea of when being in the south and something like cold in the north, or Shanghai in the north as well. Well, he was in Beijing when he wrote this, which is in the north of China. And this is the most important book on warm disease. And the other thing as well is that what school is in the south that's very famous? The Hoshan Pai, the fire school, uses so much aconite as well. So sometimes when we hear these ideas, we got to look back and look at the practical reality of what was being practiced, of how it was looked at as well, and think, okay, maybe in some cases this north-south divide was there, but then when we look at what was being done and what was being written, how true is that in terms of practice? Not to say that was what they say about north-south is incorrect, but I think it's also not necessarily only that black and white reasoning of north and south, hot and cold as well. Because, and once again, I mean, like, people will also, when they look at Wu Zhutong, they think, oh, warm diseases, he disregarded the Shanghai Lun as well. Actually, in this book, nearly half the formula are either from the Shanghai Jingyue or slight modifications of Shanghai Jingyue formula.
Okay.
The first formula he mentions, same as in the Shanghai Lun, Gui Zhutong. Next one he goes, In Chao San, then Sang Ju In. Okay. So, and even then he'll say, like, he disagrees with people and things like that, and he'll say, well, he got this wrong, like he had a very good approach to this, but he might have gotten this wrong, or things like that. So he tries to still be respectful when he's disagreeing with people. Jingyue, not so much. There's a quote there where I think he might be talking about Zhu Danxi or something like that, and he goes, "Oh, I held my sleeve up to my mouth," which means he's basically covering his mouth while he's laughing.
Okay.
And there's other things in there where he's like, "Oh, I sigh for the people that he treated," or something like that.
Okay.
He's a bit dramatic, but
The main author.
no, the Jingyue author.
Oh,
This
okay,
is Wu
yep.
Zhitong. Yeah,
Yeah,
he's a little bit more, I think, not as critical
Yeah.
as well, but he still has his own kind of like interesting ideas.
Yeah.
I think.
And just because people are watching this, might be students and stuff. This kind of text, is this something that people who are clinical minded? This is what they would get. This is.
Oh, absolutely.
Yep.
What
What benefit would this, apart from the knowledge itself? Why would you? What would?
So
If you're a student of Chinese medicine,
if you've tried
read this. Yeah.
if you've tried to read the Shanghai Lun,
Yep.
it's difficult, is it not?
Of course.
But in Chinese, you have commentaries and guides, and they help you. Okay. And now, like even when I read the original Shanghai Lun, you read things and you think, what does this mean? What does that mean? It's very succinct, and there's not much explanation. So the Chinese have spent basically since the printing press in like 1065, which is they had an imperial press, and they put out some of the famous books like the Neijing, the Shanghai Lun, I think like the Mai Jing, the Systematic Classic, things like that. When those came out in publication, people started trying to explain them as well.
Yep.
So one of the other explanations is the Zhujie Shanghai Lun. So what this one does is that Wu Zhitong tried to write it in the style of the Shanghai Lun, so just kind of these single lines,
Yep.
but then he wrote his own commentary on it as well. So you kind of get a beautiful understanding of his way of looking at nature, of physiology, and even though Western medicine was a little bit around China there, it seems to be quite unadulterated by a Western style of thinking.
Yeah. Okay.
And so he talks about, dryness, dampness, all this kind of interesting ideas, 6 channels that really you won't find anything else. The other thing about this one is as well is that we always talk about the classics of Chinese medicine. Okay, what are they? The Huangde Neijing, Su Wen Ling Shu, Mai Jing Nanjing, Shanghan Zabing Lung to Shanghan Jingui, maybe the systematic classic, the Zhenju Jia Jing. Okay, in China they'll often put together what they call the 4 classics, and those are often the Neijing, so the Ling Shu Su Wen, the Shanghan Zabing Lung, but they divide those up into the Shanghan Jingui.
Yep.
And then sometimes they'll include the systematic differentiation of warm diseases.
Okay.
All those texts were written around like pre 215 CE. This one was published in like 1798. So this is the only text that kind of in China that has reached the status of those classics.
Yeah. Since what's considered proper the classical period. Yeah.
Which it's like, and that's when I was talking to Alan and we were kind of deciding what to do. Is like, well, this is really the only main text, because we have translations of the Su Wen, the Ling Shu, the Shanghan, the Jingui, but no one has done this one yet. Yeah. And I mean, like, this is half the text, so you can kind of see why someone might be reluctant to do it. Yeah, part 1.
So there's going to be only a part 2 or part 3?
No, just part 2.
Yeah.
If there was part 3, we might not have done it either.
Okay.
But this is a really important text. And so he's the creator of formulas like Incha Sun, Sang Juin, and he has some other kind of famous ones. He uses quite a lot of other famous formulas as well, but I know that he was the creator of those 2. He used some other ones, but they might have existed prior to him doing it. So he is really seen in a very, very high level in terms of Chinese medicine and his understanding. And even when people would study acupuncture, they would say, well, I don't practice herbalism, I shouldn't read the Shanghai Lun. Well, no, that's actually such a bad mindset. Because what I noticed is that when I would read early acupuncturists in the 20th century, so there was a couple of famous people, a guy called Cheng Dan Nan, who was from Nanjing. He went to Japan, and apparently he brought the Gai Chu back to China. But there was another guy from Shanghai called Lu Shouyan. And both of these guys were writing textbooks around that period, and they sort of set out the prototypes for textbooks that we have today based on the points, the channels, the way that they lay them out, very, very similar to how we read them today. And what's very interesting is that first off, Cheng Danan wrote a commentary on the Shanghai Lun, but with acupuncture points. Okay, Lu Shouyan I did some research on him talking about anxiety patterns, and a lot of his anxiety patterns straight out of the Shanghan Lun. And he'll pull them out and he'll say like, oh, this pattern might be similar to like a Guizhi tongue or like a Guizhi Gansao Longumuli tongue or Guizhi Gansao tongue or Zhou Gansao tongue. These sort of palpitation patterns, and so he lists the line in his acupuncture book, which shows that these books. Well, at least in my approach is that even if I don't necessarily prescribe what the doctor is prescribing, what's important is to understand their approach and their mindset and maybe how I might adjust that into my way of thinking as well. Yeah. So you don't just kind of think, oh, well, I won't ever do this. So if you're an acupuncturist... It's a
theoretical concept, right? Like it's teaching you a theory of how to treat it. They're just using herbs in that instance. But that theory, like you said, could be applied to acupuncture in some cases, or vice versa.
Well, exactly. Like in the Shanghan Lun, like one of the most common things, even acupuncturists will say, oh, if you have dampness, are you thirsty or not? Yeah. Now that you see that in the sudden turmoil chapter where they're discussing, do you give Wu Ling San or Li Zhongwan? Is there thirst or not when you have this kind of vomiting? And that tells you, is there dampness or not in the body as well? And even in acupuncture, that's very much applicable as well. So you just kind of have to not necessarily read about the treatment, but think about what is happening in the body and the physiology. And so much of what we know today in TCM comes out of the Shanghan Lun. And so I would even argue, if you're only a Jingfeng practitioner, don't necessarily fixate on the treatment, but try to understand what's happening in the body and the lines. And then maybe you think, well, okay, I'm not going to prescribe Zhang Jingyue or Yin Chao San, but what might be a formula that I could see working in what he's talking about in my own system that might work for that.
Yeah, interesting. So read the books, students and practitioners. Yeah, it's good. So what do you get most excited about now that you've done all of these things? What's your favourite to work on? What do you love to...
Look, I think, nowadays, there's a famous quote from Confucius, or from what they call the Analects, the books that he wrote. And that is, it says, to study and then practice, is that not pleasurable? And so this is where I think in Chinese medicine, a lot of people, they practice, but they don't do so much study as well once we finish school. And I really feel like, I still get excited when I read a new book or something like that, and I think, oh, this is a really cool way of approaching something that I haven't seen before. Or, watching an interesting lecture or something like that, and then being able to practice it in clinic as well. But we need to, one thing in Chinese medicine, at least what I've seen from these guys, is that you need to study frequently and get better and better as well. Because what I do notice in Chinese medicine is that people will badmouth Western medicine or biomedicine doctors. But I can tell you, those guys work very, very hard. Most of us, we couldn't match their study regimen. And we should be trying to match their study regimen, because that means that we will be better Chinese medicine doctors, which means that we will improve the standing of Chinese medicine. Because in Chinese medicine, we often don't have the luxury. And what do I mean by that is that if people go to see Chinese medicine and it doesn't work, they will blame Chinese medicine. In the West, biomedicine, they go see biomedicine, or this drug didn't work, or the surgery didn't work. They're not like, biomedicine didn't work. In Chinese medicine, you often get the one chance to do something well. Yep. And so I really feel like we're all in this together. We need to try and help people and our practitioners be the best that we can, because if we aren't delivering good results, and I always feel like I have so much to learn and I still need to get much better in clinic, but we do need to try and help people get better, so that when people come and see us, they know that it can work, and then they can spread the word of mouth, because there's not very many traditional medicines around today, and I don't think very, very, very few have the standing of Chinese medicine as well. And at least I don't think many have the literature history as well, the cases. So, but we still need to practice it in a good, effective way, so that it can continue to exist. Otherwise, in the next 100 years, they might be writing about Chinese medicine like they do about Greek medicine.
Yeah.
It's just in a book. It doesn't exist. And so we really...
I love that, what you said about they blame the whole profession, and we have a responsibility to our profession.
Yep.
But also, like, for me, like, I've been doing this 24 years now almost. Like, oh, am I that old? But I went into Chinese medicine very young. I was 17 when I was in my first class, straight out of high school. I didn't even know what it was. I'd never had acupuncture.
Yeah.
I'd never used Chinese herbs. I was just like, oh, this is mysterious and cool. I think I might do it. And I was in my first class, and I just was like sitting in there, and it was Wade James that was the teacher. And I was like, this is exactly what I want to do with my life. I just remember having that dawning thing. And I remember looking around at the room and thinking, because I was literally the youngest person there was no school leavers there. And it was just such a great time, like studying, being a student, right? Okay, everyone's life in student life is good, okay, because there's many reasons for that. You don't have any encumbering factors in your life, okay, whatever they might be as you're older. For me, I was young. It's almost like you're young and carefree, okay? It doesn't matter if you're poor, you just
well, most of your other friends are as well. So.
Yeah, exactly. Like you're all in this together type of thing, right? Well. And there was many students there that were adult age. Nothing wrong with adult learning. It's awesome. It's a great thing to do. And then I did China, and I just felt so sad when I left 3 months in China. Like I remember almost crying, and I really wanted to just go back there. And I was like, I'm going to sell everything I have and go and live in China, because I was like, I just really enjoyed that thing of that camaraderie of other practitioners around you as well, and that whole thing of like learning and practicing. Okay. Now I didn't go and live in China. I was thinking more like 7 years in Tibet. Like we'll just go away and become a monk or something. Not that I could probably do any of that life. But then the next 10 years pretty much was just me practicing. Now I had other practitioners in my clinic. I was teaching as well. And so I had a lot of stuff going on, but I wasn't like, and I can't, if I'm honest, I wasn't like reading these books and learning something valuable. I was learning things, and I was thinking about concepts and stuff, and all that stuff. So I would say I was doing more than the average practitioner, but I wasn't doing as much as I am now, right? And slowly but surely, like the practice was busy. The patients were coming in. It was no shortage of that. I was just becoming bored of it. And I almost quit Chinese medicine because I was like getting interested in other things, other businessy things, and then I come across the system that I'm doing now. Most people know I do the sort of classical style, and Michael has been training in that same system. That's why we're here today, because we've been on a course for 5 days. And what you said about learning, and like, what was that quote again? That Taoist quote?
Well, not Taoist, Confucian.
Sorry, Confucian, sorry.
To learn and then practice it, is that not pleasurable?
Exactly. And that is, like, I've almost discovered a new pleasure in life, right? Because I just can't explain it. And you feel, you know that you don't know everything, but you know a bit more, and you go and do some more study. And for me, it's better to go and do a course and sit and have someone teach it to you, right? That's pleasurable. It's more pleasurable for me than sitting there saying, I'll read a book today, because I think that puts some people I can read a book, but are you going to read the book? Probably you might not. Well, okay.
The other thing, sometimes you read a book and you flip the page and you think, wait, what did that page say? You have to go back and reread the page. I'm very guilty of that.
Yeah. And I think that's why you have good teachers in the classics that will be able to explain those things, because I remember being in school and people saying, if you want to be good at Chinese medicine, you have to read the Neijing. And I would just like open it up and sort of like try. And then it was so hard, and then it wouldn't happen, right? And I'm sure a lot of students watching this, and maybe even practitioners, in the same boat, right? But that thing you said about it makes your clinic more pleasurable when you're doing that study. So whatever form that takes for you, whether you go and do courses, or you read books, or you take up some kind of scholarly pursuit, I think we have to incorporate that into our work week.
Well, they have a famous saying in Chinese, and I can't remember it actually in Chinese, but it's half a day in clinic, half a day of reading.
Makes sense. Yep, makes total sense.
And because I can tell you, you're probably going to have patients in your clinic that you aren't getting the 100% result with. So you should look up that to try and figure it out.
Yeah.
I tell you, like I had a little bit of a similar story to how you got into Chinese medicine, except I was always interested in history and music.
Yeah.
But my mum said, "Oh, you're not going to make enough money in either of those." So
Good call.
well, then I went to study 1 year of massage, and while I was there, I had a family friend who was a lady called Waveney Holland, who was the president of AACMA in Australia, and she went and treated me. And I was going to study exercise science, and she goes to me, "Oh, you should study Chinese medicine because you'll be able to help more people." And so I thought, okay, yeah. So I went home and I'd never actually gotten a massage before studying massage, similar to that.
Yeah.
And that was the first time I'd ever got acupuncture. And after that, I was like, all right, I'll go and study acupuncture. And so I was quite young. I was also similarly like yourself, maybe not the youngest, but one of the sorry, not the youngest, but one of the youngest. But then when I finished, I was going to study some Western medicine. And another great Australian practitioner he'd gone to America, a guy called Greg Bantic, he was back in Australia now. I was like, well, I was going to study some Western medicine or something like that. And he just goes, oh, well, why don't you study Chinese language so you know what they say in Chinese? Or, well, so you know what is real in Chinese medicine. So that's kind of how I got started. I met people at the right time that directed me into the right path. But what I was thinking was funny enough is like I started out, I was probably like one of the youngest in the class. Then when I went back to teach, I was also one of the youngest in the class. There was more older people than me. Students, because people do tend to come into Chinese medicine later. But if you are watching this and you are younger and you are finishing Chinese medicine, I really think that you should try and learn Chinese language because I never, when I started learning Chinese language, did I think I would ever do anything like this. I don't even know what I thought. I just thought kind of a similar thing. It's like, hey, I want more of this carefree student life. Sign me up for another 3 years of that. I'm not ready for all this stress and to be an adult, I went to spend 1 year in China as well, studying Chinese, which was really interesting. And then I came back and I did some classical Chinese again. And I never ever thought that I would be sitting here with all these books, and we got another 2 coming out this year, and probably the second volume of the Wenbing Tiabian, either hopefully very early beginning of next year. Alan has started working on that, and it's just I feel very, very fortunate and lucky. Well, I think there's 3 things in life that I think kind of define it. First off, it's a little bit of luck. You have to be in the right place at the right time meeting these people, okay? And maybe, you have to work hard, okay? Yep. So there was that thing where I said I completed the first chapter and I sent it to Alan and he was happy enough to say, yeah, okay, you've done the first chapter, let's do it together. If I'd never done that, then it would never happen. Yes. And it might sound a little bit strange, but there's a little bit maybe of like destiny, okay? Okay, when it comes to Chinese language, I will be the first person to say that I am terrible at speaking and listening. Like, even put me in a beginner's class and I will probably not be able to tell what people say. But I was very lucky that I have a very good visual memory. So reading characters and memorizing characters, no problem. I can barely speak at first grade, and I lived in China. It's literally in one ear, out the other. But I was blessed with what I am able to work with and what I need to work with. So I was very, very kind of fortunate. So that's kind of the 3 things that I think, but it doesn't matter if you have destiny or luck if you don't work hard. Yes. Work hard is kind of the underpinning of everything. Yeah. And,
and I think what you said without saying it in there is you've got to be willing to take a bit of a risk. Like you didn't wait until your translation was even more perfect. You had to reach out, and that's a risk. Like you've got to take a bit of a, to explore.
Well, in China, they talk a little bit about this concept called yuanfen, which might be like destiny, meeting the right person at the right time and things like that as well. But you have to be there to kind of make it happen as well. Yeah. So I was very, very fortunate. But my advice is always, if you're doing Chinese medicine and you're young, strongly consider doing Chinese language. Even if you don't want to translate, it will still open up a world of possibilities, because Chinese medicine has really been, since they've writing, for the last 1,000 years, like a dialogue. You see people constantly quoting later authors talking about concepts like the San Jiao. They talk about Ming Men. They talk about the 6 Qi as well, or the 5 phases. How do these things integrate? They talk about different kinds of like pulse diagnostics, formulas. And sometimes when I see people talk, they might talk about something like a topic of the Sanjiao. They mention a little bit from the Neijing, and they mention a little bit from maybe the Nanjing. But then there's like all this information, and I don't begrudge them, because obviously they don't speak Chinese, but they're missing out all these kinds of discussions about certain topics that have been really fleshed out quite a lot in Chinese. It's just we don't have people to bring them out as well. So I really hope that if you have the time and the ability to study Chinese, that you will. And also, if you're ever thinking about doing it, you're welcome to reach out to me and send me an email and let me, because I really, I was lucky enough to have people that encouraged me. So if you're thinking of doing that and you want some, advice or something, or you're like, what Chinese book, if I'm reading Chinese, should I read? You're welcome to reach out, because it just sometimes you need a little bit of guidance from someone. And if I can help someone with that, because I feel Chinese medicine, we need to leave it better than we found it. Like that's the goal with anything. Yep. But has been my goal with Chinese medicine. And I was really lucky to study with people at the college like John McDonald and Greg Bantic, and both of these guys. And and I even met I think another guy called Charlie Buck, and he said, the work and stuff you're doing is great. And I said to him, it's like, these kinds of things are not possible if we don't have that generation before us that help us and guide us as well. Yeah. So,
and also just to inspire you, right? To inspire you that that's a possibility. Like you start to see, there might be a place for me, and like what you've said, like you've got unique skills, you've put them together, and you're like, really good at that. It doesn't matter if you can't speak Chinese, and who cares? Like,
it's just you got to like you say, keep working hard, and Chinese medicine is a very kind of both, how do you say, like it's both kind of like rewarding but very, very difficult as well. But when it's rewarding, it really is the kind of the best thing on earth, And I think so underestimated how hard it is, and it's not really a valued profession in Australia on the whole. Like, I mean, I know all the people I know are now Chinese medicine people, so not everyone, but Thank you. And the more you've been at it, the more you respect. But like I would be common. I've been in an Uber before, and you tell the Uber driver what you do, and he goes, "Oh, do you have to study to do that?" A common question, and it's I don't take that personal or anything like that. But you think, a patient asked me that once, like, and they were like, "How did you have to study to do this sort of thing?" I was like, "No, I just learned it on Google." Supposed to stick the needles. Like, what do you think? What do you like? I think it's more like just wait a second. I'll go ask ChatGPT your diagnosis.
I think it's just because it's not known. Like every time I go to China, they have this awe and reverence for Chinese medicine. Okay, because it's been around, like you said, it's always been the medicine. That is medicine, right? And there's almost like, especially some young people, they kind of revere this idea of this, we should get back to the traditional, especially food medicine, be healthy with foods and traditional ways and things like that. And there's a generalized respect for it, especially as a Westerner. You go there and say you do Chinese medicine, they're always like, what? Like, I was there last year at a factory to look at tiny homes, right? Like I was with a friend and go around China. He's like, "Do you want to come to China?" I was like, "Yeah, why wouldn't I want to go to China?" So we just went for a week to these tiny home factories. And I don't know anything about, I'm learning about cladding and all these different things. And, you just sort of sitting there, he's looking at all the homes. And one of the girls after we've done the main business, you sit around and, my friend loves doing this because he knows he's seen it enough times to get the reaction. And he goes, give him your card. Give him your card. I'm like, that's not good. Like, he's like, he just wants to, so he goes, "Do you know what she does?" And they're like, because they just think I must work for a fucking home factory or something. Yeah. Give the card, Chinese medicine. Oh, wow. And then they want you to feel the pulses as well. And it happened to me once when I was at the Canton Fair, which is a big, massive fair. and you're sitting in this display place, open and everything, and I'm sitting there like, you know, zoning out because my friend is doing his thing, and it wasn't a thing I was interested in. And she'd found out that I'd done Chinese medicine, and she was like, "Oh, my breasts are so distended," and she just grabbed my hands and like put them on them, and she was like, "Feel my breasts," and I was just like, you know, Chinese just don't have that concept of privacy either, because they're just so used to, especially you go to hospital, it's everyone everywhere.
Yeah.
And then when we were at this tiny home factory, I think he had told her before we were driving from there to the lunch, and she's like, "Oh, you do Chinese medicine?" She goes, "Oh, can you feel my pulse?" And I was like, "Yeah, no worries." And so she's in Chinese to the driver, and she'd get the driver to pull over while we're driving to the lunch, and she puts her hand in. I was like, she's trying. I said, "Just wait till."
Wow.
What was funny, and then I said to her, I gave her a formula. I said, "Oh, you know," it was something like a Sherchin tongue or something like that. And I said, like it was, you know, that's an easy one in the things that we do. And I gave her the formula. I just said, "Oh, you need to get these herbs because it'll be easy for them to source it." And I said, "You can find these and take it." And I don't really have that much connection with them. And then my friend who's buying the home was like, "Oh yeah, by the way, that was really good. Like, she thinks she feels so much better, and she wants to." You know, like it was good for his relationship with the tiny home. Yeah, but it's just like I feel sorry sometimes, not sorry, but you know, it's can be a bit disheartening in working in the Western world when you've never experienced that. You just study so hard doing Chinese medicine. As a general practitioner, person who just does a degree here, they don't really go outside, and then you know it's just like, you know, it's not that respected, the profession. Right?
I would really encourage people, if they can, to go to China as well. Definitely. And to see it over there as well. I think an interesting thing that you were talking about is like how Chinese medicine is viewed in China compared to the West. But one thing, I remember this idea that my friend, when I was studying in China, in Nanjing with Dr. Huang, Mark took me to see a friend, and he was a guy who did Tai Chi and played Gu Qin as well. But he was also knew a lot about tea. He was just talking about when he was like pouring tea, he was just talking about, even in pouring tea, he was talking about the yin and the yang.
Right. Wow.
And it's just like in that moment, like I'd already studied a lot about philosophy and things like that, but it was just kind of like just to understand like their whole view of the world is so much about 5 phases, about yin yang, that we just kind of, and we get very much trapped in a way of thinking about medicine, but everything that they would look at can be applied to yin yang. And I know like we always say it, but just still in that moment of thinking about when he was pouring that tea, talking about the levels of yin yang in the tea, it was just, I think about it and just think, oh, that's so cool. It just kind of took a little bit of like the shackles off of my mind.
Yeah.
And it was a very interesting guy because he was like, he did a lot of Tai Chi and things like that. And he just goes, here, try to push me. And I mean, I'm not like a small guy. I was trying to push him, but I just couldn't move him. He just had like the strongest kind of like
he's
core.
like, test me.
Yeah, test me. And I'm like, trying to push him. And I was like, all right. I was like, okay, let me see if I can give him a rugby tackle. But no, I didn't do that. That was but it was very interesting because I just could not move this guy.
Wow.
And he didn't look strong or anything like that, but just, and I kind of thought to myself, well, maybe I should do Tai Chi, and then that went and I'm back running. So one day maybe when I can't run, I'll do some more.
Yeah, you've contributed enough to the culture of Chinese classical and medicine. You don't have to do Tai Chi as well.
If I could talk, I think on another interesting point, I think where in the West we talk a lot about this idea of what happened in TCM as well. And I think that sometimes when students go through, they have this idea that, I'm just going to study whatever's in the uni, and then once I get out, I'll figure out what the real medicine or something like that is as well, you know. And I hear a lot of people say, TCM maybe isn't real Chinese medicine, that it's like bastardized and things like that, you know. I think that needs to be looked at because TCM is really, it is a repackaging of Chinese medicine, but that has been happening throughout history. Even what Zhang Jingyue did in his books is a repackaging of Chinese medicine.
Right. Yeah.
So whenever people would write these books, they would just repackage Chinese medicine in a certain way. and just the way that they did it there. Like people will say, oh, Zhang Fu diagnosis and things like that. That's a lot to do with moderns. You can find earlier books with very, very similar diagnosis in the way that they teach it as well, where they talk about the foundations as well. Zhang Jingyue's commentary on the Neijing laid out very, very similar to our foundation courses 400 years earlier as well. So to me, saying like TCM is just like a modern version of Chinese medicine and things like that, there are some arguably modern concepts in it, but Chinese medicine has also developed along with the times as well. So that's not necessarily a bad thing as well. And what I would say is that, try to learn as much as you can about Chinese medicine when you're a student as well.
Yep.
There was, I think...
Like the history, you mean?
Well, just everything about clinic, about herbs. And even, once again, if you're only an acupuncturist, go read the Bensky et al. Formula and strategy books, because that will... Because even like a lot of the acupuncture ideas are taken from the herbal ideas.
Definitely.
And when you read those herbal formulas, they actually give you a very, very good insight into certain patterns. Like, maybe heart yin vacuity, heart yang vacuity, spleen damp, or, hot stomach, spleen cold, things like that. What would you say, wood invading earth? Like all those ideas come generally out of herbal formulas. Yep. Acupuncture can treat them, but the concept or that diagnosis often comes out of herbal formulas. So reading those books will be very good, because often my students ask me where we're going to read, and I would say, well, this matches this herbal formula. Go read that in Formulas and Strategies. Okay. And that will help you understand it. Even once again, you just have to think about, okay, what is the formula doing, and how do I juxtapose acupuncture on top of that as well. So I think those kinds of things will help you a lot. The other thing as well is that I think, and I might have not been a guy, Leo Locke, who said this, but Leo said something like this, like you really, and this might be an old Chinese quote, or he might have just said it himself. He goes, you really got to kind of almost like work to the point of exhaustion when you're a student. Why? Because then when you finish, clinic will be easy. Yeah. Or easier, I should say. Yeah. But if you just be a lazy student and things like that, and I definitely could have worked harder as a student, but sometimes being when you're in that younger age as well, you still got to have a little bit of time for partying.
You got to enjoy your life.
Yeah. But you do have to work hard as a student as well to try and help these people when they come in the clinic as well. So that's something else that I would say as a piece of advice as well. If I could go back and tell my younger self probably wouldn't listen, but he did.
Isn't it the way?
Yeah.
Yeah. Oh, this has been so great. We've covered so many topics, and it's been wonderful to. Yeah. Have you got anything else?
Was there anything else in Chinese medicine you've kind of wondered where it's like, I've thought about this. Is this true or not? Is there something that you've thought about where you think, I would like to know this, or something about
you're really
a topic, a theory, or something like that, or anything where you thought, I might know, I might not know,
I don't know.
You thought you were just going to talk and not have to think.
Yeah, I know. Right? Yeah, exactly. I didn't prepare to think.
This is what I do. I get to the interview and then I flip it. I'm now the host.
Yeah. Wow, you're really putting me on the spot. Okay, you mentioned the guide tubes introduction.
Yeah.
That is an interesting thing a little bit, because, is that something that it was just invented for Western people to use acupuncture, or
no? From what I understand, and look, my colleague, a guy called Corey Dillo, and he's releasing a book about the history of acupuncture channels. Okay, that's going to be really interesting. I'll come back to that topic in a moment, but I'll just talk. He knows a lot more about the guide tubes, and I believe he said that there was that there were a lot of Japanese. Maybe I'm thinking of a different doctor, but. I think he talks about a different Japanese doctor who did a lot of these acupuncture techniques, but it came from Cheng Danan, went to Japan, and they were using it in Japan, I guess. I'm not sure for what reason or why, but it wasn't for Westerners, and then he brought it back to China as well.
Roughly what year was that when it came into China?
Oh, look,
roughly?
I think Qing Dan lived from around maybe 1890 to around 1960s. So I
Yeah.
would have imagined around maybe 1920 to 1930 he came back to Nanjing. And
Sort of like end of Qing dynasty, something like
oh,
that.
well, Qing dynasty ended about 1912.
Okay.
So that and then
Past that.
yeah. So but I think I can't remember Qing Dan's exact dates, but he was around that era. So maybe 1920 to 1930.
Yeah.
I don't know if there was still like folk use of the guide tube or something like that, but that seems to have been the pivotal time that he brought it back. But even in China, you would still find a lot of physicians doing hand insertion. I do hand insertion. I used guide tube for a while, but I thought, you know what, I'm just going to go to do hand insertion. And I feel better at doing hand insertion generally than I do with guide tube. I still do some guide tube with some patients because they don't seem to like the hand insertion. And I'm happy to just do what is best for my patients. I'm not arrogant enough that I sit there and say, you must have the hand insertion. No, if it's going to be better for them, that's
Okay,
good.
I've got the question. I've thought of it now.
Okay.
Okay. Like, it's kind of assumed that most people think with that, when they first did acupuncture, let's say in the Han Dynasty, that they weren't lying people down on a table and letting them relax like we do now. Okay, like the whole, and they obviously didn't have the peaceful music and all the rest, the whole rigmarole. Although I have talked to some 5-element type of practitioners who, would talk about maybe certain treatments where they had like people playing instruments and stuff around them. That's not the question, okay? So, but when did this concept of lying down with the needles retained come into Chinese medicine? Was it,
That's a tough one, because. Well, I'll bring up where Corey was speaking about the channels, because this kind of ties into that, because the way that acupuncture channels developed was basically by pulse diagnosis, okay?
Right.
Where originally they would take pulses at lung 9, maybe like heart 7, a little bit up on the pericardium channel, on Tai Chi kidney 3, I think stomach 43, and maybe Tai Chong as well. Okay, and do you know what all those points generally are?
Yeah.
Yuan source points.
Right.
So everywhere there's a pulse, there's a generally a yuan source point as well. Okay. But what they would do is.
So are they like checking the source of that channel?
Well, it's not a channel. Like, it's just a point.
Yeah, I know,
but it wasn't a channel.
Oh, before
so it was just. I think I might be a little bit wrong on this, but it was just generally a pulse point, where they would notice a change in the pulse when there were certain diseases. Then the pathways came later. So the Mai wasn't originally a vessel; it was just like a pulse diagnostic location, and then they would also compare this location here with other points on the body, maybe on the head, different pulsations on the head, like around there, maybe around your your ending, maybe on your cheek, things like that. And so they had these two kind of point positions, and then they started to develop the pathways in the body that would match them. So these, and I might not be 100% on this. You'll have to read the book when it comes out, and Corey is working on it, and hopefully we'll have it out. It's by a very famous Chinese historian called Huang Longcheng. So, but what did they actually do? I think they would either pierce or moxa these points at the pulse site as well.
Yeah, right.
So when you see these older books, you see, and so in the systematic classic, the Jia Jing, and even in the Neijing, it might say like needle, the Shao Yin or the Tai Yin. It doesn't list points, just lists a channel, and that is actually a pulse point. Now, in the Jia Jing, well, they had another book around that time called the Ming Tang Jing, or the Huangdi Ming Tang Jing, and at some point they started listing all the points along their channels, because it used to just be something like like lung 9 running up to somewhere, or maybe and like heart 7, things like that. Those were the points, but they started matching them and combining pathways and putting them in with organs as well. Yep. And they then started adding more points along there, dividing these symptoms that I think were originally at only a pulse site among different points to there. But what they would say is they would often say, just needle this for X amount of breaths. Maybe 5 breaths, maybe 3 breaths.
Yep.
So, and another thing is when you look at some of these older needles, I wonder whether or not they could be inserted and left, or whether or not they would have to have been inserted and held, because they were, I think, a little bit thicker as well.
Yeah,
so
yeah.
because you know now you
And they
can
would
put
have
them
just
in.
like
They've
dragged
fallen
us-
off.
yeah,
Yeah.
yeah.
So could they have been inserted and left for a long period of time? So a couple of things that I've wondered is one, was needling unilateral or bilateral? Because that's a very interesting question.
Yes.
Because nowadays people do a lot of bilateral. What I tend to do is I tend to bilateral if I'm needling on the back, and then or mostly bilateral. It depends if there's a significant musculoskeletal problem. Then I might do like 70-30. But on the front, I tend to do more unilateral needling.
Yeah.
I just like personally.
That's kind of what I do,
Yeah.
right? Like, Tai Chung on one side, Liverite on the other side, something like that. Yeah.
I don't know. To me, it does generally feel if you're doing the back, it feels nicer to have like both sides worked on. But then, and I still do like kind of both the points, maybe on the bladder channel for the back transport. But on the front, I just feel like okay, I'm not. I can choose maybe one or two as well. And so I've kind of think that I've seen some texts where they say, oh, you do needle both points, because I do list like both points after sometimes when they're listing diseases as well. So I think there's a chance that they might have used both points, but I'm still unsure of whether or not when they list the disease, is it only unilateral or bilateral? And then even when they come to the Ming dynasty, are they leaving it in for a certain amount of time, or are they taking them out? And also, are they only needling one point at a time?
Yes.
That's another interesting question
with these
as well.
combinations that you've researched.
Do you just needle it, do the next point, needle it, do the next point? These are questions that I've thought about, and I don't really have the answer to. I can only theorize. My general theory would be that they probably needle one point at a time, and they may needle bilaterally. Yeah. But they would also clean the needle by putting it in their mouth. That's important.
Oh. I thought you meant by fire. When are we talking putting it in the mouth?
I think that's what they say.
It's like Han Dynasty or pre-Han Dynasty?
I think it's around Ming Dynasty.
Okay,
But honestly, nothing's going to be on the end of the needle. Like when you think about it, when you put it in, like everything gets like left on the outside surface of the skin.
For the practitioner, but also for
I wouldn't advise
they put it in the patient's mouth, or they put it in the practitioner's mouth?
I think they put it in their mouth. Yeah. But I look, I don't think that, I don't know. They didn't have the greatest kind of like clean techniques.
No. But also, like, these things would have been hard to get. So they wouldn't have had lots of needles.
I don't think so.
You think they would have probably had, it would make more sense that they would have one here, and then the same needle would go from one to one.
Yeah. That's my guess. I'm not sure. I'm still trying to look for any information, and I've looked through a lot of books. Like I own 2 sets of 15 books each, 15 acupuncture books of the Ming dynasty, and 15 like a collection of 15 books on the on the Qing dynasty. And sometimes they have like 2 or 3 books in the collection. So I've looked through a lot of stuff, and I haven't found the answer to that question. But it's always something that, like, when I'm reading a book, I have in the back of my mind.
Like, it's just, did they ever document the patient is to lie down? Like, surely if that was part of the thing, they would say the patient is to retain it, like the needles will retain for a certain amount of time. Or it would be, if it was that was important, or either that was just what was always happening and that's assumed. That every time you do it, it's going to be just to obtain the de qi. And once that's obtained, then you move to the, because sometimes they'll mention the stimulation method, right? Or what they're doing to the point. Is that what they would do?
Yeah, they do mention that. There's a case that I remember by Zhang Jingyue, and I remember this case because he mentions using, I think, Ren 7. Sorry, not Ren 7, Lung 7 for the Ren channel.
Yep.
And he mentions he uses a certain technique on it as well. We've recently just finished the Psalm acupuncture text.
Yep.
And in that text, he mentions treating people several times before the diseases might get better as well. And this is something else that I've noticed when I've been reading Chinese case studies, is that often for acupuncture, they will see the person 3 times a week. That's more in modern China. That's more in like the last maybe 100 years for cases as well. So sometimes I wonder with acupuncture whether or not, and it's a very hard thing in the West where it costs a lot to get acupuncture, whether or not we should be trying to get people in more frequently, and then perhaps we could treat some more, or have more effective treatment for some serious diseases, where we might say, look, come in, 4 to 6 times, and we'll see if we can start getting better. And maybe, the person will say, okay, I'll see you 1 week, and then I'll see you the next week. But maybe we really should be trying to get them in, 3 times that week, and then say, okay, let's see what happens if we get you in 3 times this week and get that treatment done, and then we can reevaluate the next week, do another 3 things and things like that. Because I've read some, incredible case studies about serious diseases treated with acupuncture in China, but it's always a lot of treatment in a short time, or more treatment than we would perhaps be inclined to do in the West. So that's something that's kind of like been on the back of my mind about how do we rectify this issue of infrequent treatment while desiring good results.
Yes.
And I mean, I don't have an answer. All I can say is that, I read the case studies, and if I see someone, I say, well, maybe it's worthwhile coming back sooner than later. But sometimes people can't afford it, or they don't have the time. We live busy lives, but...
And this is where I think, I used to bring this up a lot with my students when teaching undergraduate students, like, we have to be mindful of different models and thinking about this more qualitatively in the future. You don't just do what everyone else has done just because that's what they've always done. I mean, people have tried different things with community acupuncture and all this sort of stuff and tried to create some kind of system. Well, like, practitioners still need to get paid what they're worth. They still need to make a decent living out of it. But yeah, the time is also the issue, right? Like the time for the patients, because sometimes do they have to lie down for all that time? Like, is it possible? What if they could have the same effect, but they come in and it's a 5-minute thing, right? But I mean, they still have to come in. But this is a whole nother podcast now. We won't go into it too much.
Can I be the host of this one?
Pause it. So, welcome to Michael Brown's podcast on Chinese medicine about issues I have. Complaints. The complaints department. That's what you could call it. No, not this.
It wouldn't last long with that title.
I'm just joking. But yeah, I just think it's, if you're a student watching this, you're a practitioner watching this, then I think it is something worth to just consider, to keep in your mind, to think, how can I do things better? You don't have to be, the practitioner doesn't have to be in poverty or anything like that, but there is something to this frequency and its accessibility of the clinics and stuff, and stuff like, some of my patients travel an hour to get to you. That's a big deal, right? And this is where sometimes I find herbs are better than acupuncture, just for those reasons, because I've got some patients where I know that they would get some good benefit from acupuncture, but it's a frequency issue. And I said, if you just do one treatment, it's really not going to do that much. Let's just focus on the herbs, because they live rurally, they've got to drive there, they've got to, So as a practitioner, you're hopefully thinking about these things, to make your situation best for the patient.
I think that is probably how most of us who are doing acupuncture and herbs will look at it, is that like the acupuncture maybe is for like then and now, and the herbs keeps them going away from the treatment that you would normally maybe do acupuncture, instead of doing it 3 times a week, they take the herbs and they can come back in 2 weeks as well without having to come in and do that. And hopefully the herbs and the acupuncture have a synergistic effect. Sometimes people will ask me, well, did the acupuncture work or did the herbs work? And I think there's an important, at least that I heard about this concept where if you put, like, you have one beam that can hold 2 kilos.
Yes.
Okay. You put that beam next to it, you think, oh, it can hold 4 kilos. No, 2 beams can actually hold more than 4 kilos.
Yeah.
So it's actually a synergistic effect of 2 of the things. So did one work, or was it the synergistic effect? And if you're doing your diagnosis properly and you're working with your acupuncture and your herbs, then it can actually be a synergistic effect of the 2, not just one or the other. One or the other might only be able to hold that 2 kilos when you actually needed, the beams together needed that 6 kilos to kind of like push them, to hold them up. So I think that's a really important concept, is that if we look at it individually, they might only work like that, but combining them synergistically can have an enhanced effect.
Yes.
So I think that, well, I mean, it's true.
No, this was such a great thing. I'm just like, we could just keep going.
Yeah.
Welcome to the podcast that never ends.
Well, if we're about to finish up, I would love to say, I do some teaching with Academy of Source-Based Medicine, and there I have worked with my colleagues, Will Servals, who did a book down here as well, and another guy called Ivan Zavala and Corey Dillo, and they're all teaching great courses. I'm doing a course right now on acupuncture about the channels and points. Basically, it's called the Ancient and Modern I think like use of acupuncture and channels and points, something like that. And the idea that I've tried to go through from the ancient times to the modern times to look at how acupuncture is, because I think in the West, you know, we lack great teachers. And not that I'm not saying I'm a great teacher, but I've tried to find great authors and great teachers in books to try and bring these people like you're in kind of like their clinic and learning from them, because I certainly don't feel, you know, that I have enough experience yet to teach my own things. But I do feel like I want to bring these famous acupuncturists and people. If you're in China, being a student, it's like, well, they might not read it, but you should read these because they're the people at the top of their field. And so that's what I've tried to bring in my course.
So who's your course for?
I would say whether you're a student or you're a practitioner, and maybe you just want to know more about acupuncture points. For example, you know, I've done some on my lung. I think I've done like 5 points or something like that, and it's nearly 12 hours of information
On 5 points.
Well, on the lung channel and 5 points as well. Okay. Nearly 12 hours of information on that stuff. That's going awesome. From, you know, looking at the name, the location, point, point categories, looking at the development of the symptoms, looking at what point combinations, the most prominent diseases that it will treat, and also most importantly, I think case studies. Yeah. Okay. Because I try to bring in some case studies where this point is used, and sometimes it might be a simple case study, sometimes it might be like a really advanced case study where we might never see it in clinic, but it gives us an understanding of what is possible in Chinese medicine and acupuncture for these famous doctors who worked in these hospitals, seeing the craziest cases that we might never see, but we know what's possible with it.
Yeah, that's awesome. That's awesome. It's on Instagram as well, right? You have a little...
we have we don't update that as much, but it's more on Facebook.
But people can get a little idea of what you do, right? Yeah. I think it's Ivan who's got the soft voice, is it?
Yeah, Ivan has a very soft...
I've come across that in my scroll, and I was like, oh, it's like an ASMR video. Like sometimes I just listen to it to peace out, because he's got such a beautiful voice of... a unique voice, anyway.
Ivan is a really, really brilliant guy, and you know, I'm often like where I am in Chinese medicine is actually a large part due to him, because like we met maybe online in 2015 or something like that, and he's so gifted. When he was still studying herbs, he kind of guided me through Shanghai Lun as well. Like he is just a very smart and gifted person, and I say, like, you know, we like to teach each other, but it's kind of more probably like 80% him to me and 20% me to him. But I owe him a lot. He's a very fantastic person and very giving, and he's teaching a course there on Neijing acupuncture as well, and just very, very, very knowledgeable.
Awesome. All right, so you can do that. We'll put the link in the description. So if you're watching on Spotify or Apple, or if you're on Apple, you should go to the video version, because there'll be more fun for you there. But if you've got to here now, you've probably listened to it all on audio, and that's fine. So in the description, you can find a link to Michael's stuff, his clinic, his books, and all the rest of it. We'll put a link to your source. It's called
Academy of Source-Based Medicine. Yeah.
Okay, great. And so thanks everyone for watching. And if you've got a question about this kind of stuff, and maybe you have a question that is like, you know, when Michael asked me the question, you're like, why do you ask that question, Marie? Put it in the comments below, and then next time we meet up, we'll
I might even be able to respond to it if it's a really
Michael
good question. Look, if it's something that I know and I can find it easily, I'm happy to. You know.
Oh yeah, there you go. All right. So put your questions in the comments below on YouTube, and thanks everyone. Hopefully you like and subscribe to the channel, and we'll see you again on another video or another episode soon. Thank you.
Thank you so much for having me.